we literally make innovations that can change lives, but I would never say that we literally change lives. That prevention is not possible.
Right. We can make a difference in our own lives. Okay.
Disease that is caught much earlier is far easier to treat than a disease that is caught later. And that's why governments are all talking a lot about prevention, because that's one way to manage. You are Malaysian, we should protect you. It doesn't matter where you live. How do we evolve how we finance healthcare to accommodate rare diseases? We haven't got that far yet. And I think that's the challenge of our times.
But is this a conversation that's happening? Welcome to another episode of Life Confessions, and our guest today has so many things that we want to ask about, especially since it relates to an industry that we've all been talking about, healthcare, right? Our guest today is Dr. Abdullahi Sheriff, Managing Director at MSD in Singapore, Malaysia, and Brunei. Thank you for joining us, Doctor.
Thank you for having me.
Let's start with, starting with the fact that you're leading MSD across Singapore, Malaysia, and Brunei during a time where healthcare systems are under pressure, costs are rising, public trust can shift very quickly in these situations, right? How do you approach leadership when the stakes involve both human lives and public confidence as well? It's at a crossroads that I don't envy. Yeah.
It's a really important question, and thank you so much for asking it, right? So I think first, we have to always remember that the opportunity that we have to lead a company like MSD is an incredible responsibility. We're a company that focuses on science and science that transforms people's lives. And so first and foremost is making sure that me and my entire team never lose sight of the incredible responsibility that we have for ensuring that good science is available, good science is understood, and good science is accessible to everybody that needs it. So I think that's the guiding principle.
Right.
And when you start from that guiding principle that you're trying to do good things with good science and make it available and accessible, everything else feels like a challenge that you can surmount because you're trying to do it for the right reasons. Right? What we're not doing is trying to just make available anything. No. We focus on ensuring we understand the disease needs of Malaysia. We understand the disease needs of Singapore. We understand the aspirations of families in Malaysia and Singapore. We understand the burdens that families face in Malaysia and Singapore. And through that, we ask ourselves, what is the best science that we have that can help to address that? And then we work alongside the clinicians to make that science available. So that's our North Star, and that keeps us very, very grounded.
That's your purpose.
Absolutely.
And people talk about being purpose-driven. Companies talk about being purpose-driven. In your role, where purpose is tied to real patient outcomes, how do you ensure that purpose does not become just a talking point, just a slogan, right?
Yeah, and that's one thing that really occupies my mind a lot, if I'm really honest with you, because you're right? It's a big company.
Yeah.
In a big company, there is always the risk that people forget why we're here. So we take a very specific view. We measure our impact based on the number of lives that we have reached,
Right.
and the how much we have impacted those lives. Those are the two metrics. How many people have we reached, and how much benefit have we offered to the lives of those that we have reached?
Right.
And we track that consistently, and that's how we set our goals, and that's how we set our aspirations. So if we provide solutions that help prevent disease, we ask ourselves that question alongside the Ministry of Health, who we work very strongly with. What proportion of the population are now protected from X disease? Okay, and therefore, what is the expected benefit that we expect that population to receive? And we track that. And similarly, whether in treatment, we ask ourselves exactly the same question: what percentage of the population are able to access the treatment that they need on time for the purposes that they need them for? And how much are we doing to enable that to be sustained, so that when they start and benefit the treatment, they can always continue in the way that makes sense for them.
Right.
Always respectfully driven by science, because ultimately we as a company make great scientific breakthrough innovations, but ultimately it's the doctors who decide what is appropriate, what is relevant, and what is timely for individuals. So the other thing that we try and do also is ensure that there's clarity around understanding the science that we bring, so that the doctors feel confident to be able to make the appropriate choices for the patients that present themselves.
Right. And in the leadership role that you're in, some would say you always have to lead by example. How would you describe your leadership style?
I think probably the people who work in my team are probably best placed to describe my leadership style. But I hope that if you ask them, I hope that what they would say to you is that I try to be very authentic and very value and principle based, and very and I always follow through. So authenticity, at the end of the day, we do what is right, and we are who we are, and we present ourselves without gloss and without trying to pretend to be what we're not. And in that authenticity, it means that we are also humble in how we listen to the needs of the communities that we serve. I don't get up in the morning and think, oh, my aspiration is to be the number one company in Malaysia. That's not my aspiration. My aspiration is to be the most impactful company in Malaysia.
May not want your board of directors to hear this.
I think my board will back me on this, actually, because I think my the only question they'll ask me is, how much difference are you making to the people in Malaysia?
Right.
So in the 3 or 4 or 5 disease areas in which we can focus on, if we are making the best possible impact, that's it.
Right.
So that's the one thing I'm held to account for, because
improving lives.
That's it. And ultimately that's what matters in our industry. Right?
Yeah.
And also that starts not just from the things that we make available, but also the things that we discover. So we as a company, MSD, we're proud to have been recognized as the number one sponsor for clinical trials in Malaysia. Right. What essentially that means is that we are the leading company in partnering with the incredible scientific minds that are in Malaysia to understand the various diseases that challenge populations in Malaysia, and to make available the opportunity for them to participate in trials to discover new kinds of breakthrough technologies that will make a difference for people in Malaysia, but also around the world. Right? Now that is impact. Because it then says we're working together to make a difference for Malaysia, but we're also working together in partnership with Malaysians to make a difference for the whole world. So there are many people around the world who are alive today, whose lives have been transformed thanks to the contributions of incredible clinical leaders across Malaysia. That authenticity, I hope, is how my team would describe me, because I hold on very, very, very firmly to that.
Right.
I also hope the team would say that that in terms of we're consistent and follow through, because at the end of the day, right, you can sit down and talk a good game and promise the ends of the earth, but when the rubber hits the road and you sort of, do you follow through? Do you work alongside the customers and the clinicians and the ministries of health to do everything you can to the best of your ability? I hope my team will always say that, within our company, and certainly within my leadership style, is we follow through, which also means that when we can't do things, we're honest about it, right? And we're authentic about it, and then we follow through on that. But when we can, we do.
Right. It's interesting for you to be in the position that you're in, because the industry that you're in, some people can say they want to improve people's lives, but you literally do that. You literally can change people's lives. You literally can save people's lives. And Malaysians are feeling the rising cost of healthcare and insurance, especially those in the middle income bracket who may not qualify for subsidies but still struggle with affordability at the same time. What role should pharmaceutical companies like MSD play in helping to keep healthcare accessible? Because cost is such a big issue.
Yeah. So just if I may correct on that. So we literally make innovations that can change lives, but I would never say that we literally change lives. The reason is this: human biology and human medicine manifests itself distinctly in different people. So 2 twins may have 2 different diseases that afflict them, or may have no diseases that afflict them. And ultimately, I think the people who make the biggest impact are the clinicians who are able to sit in front and work both from a prevention and treatment perspective and make incredibly difficult judgments that help ultimately people get better. So I think credit where credit is due is the clinicians, I feel, who are the superheroes in this. And our responsibility is to make a positive contribution in the tools that they have available to them, so that when they do make those choices, they have a better chance of those choices translating into impact. So yes, I'm glad that we contribute, but I wouldn't go as far as saying that we're the ones who really do that. So with
and
that,
you're humble as well.
but it's authentic. I guess I hope it's the truth, right? And then people see that as there's the truth that it is.
Right.
So linked back to your question, right? In terms of, so there are a couple of things that are universal around the world. Healthcare costs are rising universally around the world, but actually not necessarily for reasons people might think. So a major cause of this is sometimes diseases that are identified and diagnosed late. Sometimes it's things that we take for granted. We know that there are certain lifestyle choices that we can make, whether through preventative screening, whether through dietary changes, whether through vaccinations, etc. Whatever the lifestyle changes might be, that if we took them early, might mean that we don't have to incur the consequence of what might come downstream. Right? So what we are seeing in growing costs of healthcare sometimes translates into delayed action that has then increased the cost associated with treating delayed action. So that's one. Second
like a chain
one is
reaction.
Yeah, correct, right? Because at the end of the day, right, if I am a disease that is caught much earlier is far easier to treat than a disease that is caught later. And that's why governments are all talking a lot about prevention, because that's one way to manage the costs associated with healthcare.
Right.
The second part of it is also the fact that we have a broader range of interventions that are available today. Right? There was a time where if you literally pricked your finger and it started to get infected, you'd had to chop off the finger. Right? Then we got to a stage where, we could isolate it. Then it got to a stage where you could use antibiotics to be able to manage some of the infection associated with that. Then technology continued to improve. Do I need to get stitches? I know stitches now can be done outpatients, the robots, etc. And now all of a sudden it becomes easier to manage all of those, but the range of interventions that are available are also a lot broader. So therefore a health system that was built on everybody was consuming paracetamol, right? Is now a very different health system.
Yeah.
So yes, we're paying more for health, but we're also paying more for a range of options that are available to us, which I think we should recognize and celebrate. Then the third dimension, though, is that consumption also drives costs in healthcare. So how much of existing services do we need or do we use, which is why you hear a lot about the value-based healthcare conversations, etc., because the move is towards ensuring that people use what is appropriate. Because again, utilization of beyond what is appropriate can also sort of drive costs. So I don't think it's easy just to say that the cost of healthcare is rising. That is it's easy to declare it in that way, but the reasons for it are fairly complex.
Right, because it's more nuanced than just
Correct.
rising costs.
Exactly.
You mentioned options, you mentioned early detection. Based on what you've seen, how much of an effect does lack of early detection affect healthcare in the people that you see? Yeah.
Significantly. Yeah. So there are certain diseases that are almost entirely preventable through a combination of,
lifestyle changes.
I can
say that because I hear the doctor say it every single time.
Right.
Yeah.
And I'm on top of my vaccinations, and if it's screened and caught early, and the difference between that can potentially be life and death.
Right.
And the cost associated with managing that is fairly significant. So to answer your question directly, whether it's in cancer, if you think about the opportunity to catch breast cancer early because of early screening, that's why governments encourage that. And that's a really good thing. It's an important thing. Because a woman or a man, because men also catch breast cancer, just to manage that myth out there, right? So a woman or a man who has early detection, who has breast cancer detected early, has a far higher chance of being able to not just have it managed, but also go back to a very healthy, productive life. Right? So it does make a big difference.
Right.
But part of that also is that we also have now the technologies that make it possible for us to do that.
Right.
And here's then the challenge for early detection, right? Because if I live in the Klang Valley,
right,
the probability of me benefiting from early detection is a lot higher than if I lived in a rural community somewhere in another state.
Right.
So that's the challenge of our times. Everybody knows, and most people will agree that early detection is a good thing. Most people will also agree that preventative action is a very good thing. And most people certainly within urban communities, will have the option to do that. The challenge we all have is how do we ensure that that is universal and that opportunity is equitable.
Actually, that brings us to the very next question here, because we still see differences in early diagnosis between urban and rural areas, right? This often means patients in smaller towns get diagnosed later when treatments are already more expensive at that point and less effective. What practical steps is MSD taking that actually close this gap? Not just, being able to discuss it, but are there steps that can be taken?
So there is definitely steps that we all can take. And there are contributions that we as a company, MSD, is definitely making. But I think the important thing to recognize is it takes a village. This literally takes a village for us to solve, and everybody has an important role to play. So from an MSD perspective, our fundamental belief is that the people who drive the most impact in the health system are clinical professionals.
Okay.
And that solutions can only be addressed for challenges like that through partnerships and ecosystem. So we respect what we do very well, but we also respect what we don't do.
Right.
So we are absolutely committed to finding and building positive and constructive partnerships with members across the ecosystem, public and private, NGOs and non-NGOs, for us to be able to enable the development and strengthening of healthcare system and delivery models that reach hard-to-reach communities.
Right.
So when, for example, we have the incredible privilege of being approached by a range of stakeholders across Malaysia following the COVID pandemic around the challenges with HPV-linked cervical cancer. And the reality is Malaysia has done an incredible job for many decades around the HPV program. The Ministry of Health deserve a huge amount of credit because they initiated a HPV prevention program many years before most countries, even in Asia, even in ASEAN did. And the vaccination rates, the awareness rates are fairly high across Malaysia, and real credit to MOH, credit where credit is due. But obviously with COVID comes a disruption. Kids were not at school, prioritization around COVID vaccinations, et cetera. So therefore, when the program was to be initiated, there was a recognized gap, right? Because you had a couple of years where people were not where they should be. Now, and the MOH took positive action to be able to bridge those gaps. Again, full credit to MOH for that. But there was also a recognition that there are people within hard-to-reach community groups, whether those in rural areas or whether those who've dropped out of school for one reason or the other, who may not necessarily be caught in the re-vaccination initiatives that initiated post-COVID. So a coalition across Malaysia was determined to make a difference on that. And we had the incredible privilege of contributing significantly into that, enabling 300,000 vaccines to be administered across the whole of Malaysia. But the most important part of that, in my view, is that the clinical community came together to build the infrastructure in collaboration with National Cancer Society, NCSM, and other stakeholders, where they built the delivery models that allowed them to go into rural communities. So therefore, it didn't matter where you lived. You had a chance. You are Malaysian. We should protect you. It doesn't matter where you live. So you should see the incredible work that they did, right? Whether it's getting on boats, whether it's driving through hard-to-reach, groups, but they got there.
Right.
And that's what it takes, in my humble view, to be able to address equity. We play our part in making available what it is that we have, but we also partner with others in the ecosystem who solve various elements. Some is logistics, some is medical education, some is clinical service delivery, some is financing, and some is policy, as the MOH does. But together, we will make it work.
Right, because you're one part of a larger machine.
Correct.
You mentioned we were talking about prevention earlier, about why it's so important, right, to catch things early. Why is it, in your opinion, that prevention is still so undervalued? It seems like a step that's being missed. How do we make early screening a cultural norm rather than just an afterthought? So many people find out too far down, or maybe not too far down, but they find later in the stages that they have something that would have been so much simpler to treat if they had found out sooner.
It's a very good question. To be honest with you, I wish I had the perfect answer.
Right.
But here's my postulation. Postulation number one is we always have an optimism bias. It's not going to happen to me. It's the other person, right? So therefore, tomorrow, because we're overly optimistic. And that is a major challenge for prevention. It's easier to deal with something you can see.
Right.
It's harder to deal with something you can't see yet, but you believe may or may not happen, right? So I think that it's human nature. It's not, it's not particularly single to any community or any culture. It's just generally human nature. We don't tend to prioritize the things that we don't feel in that way, and that is where we therefore fall short.
Right. Is there a bias between men and women? Yes.
Oh, you're gonna get me into trouble now. I think it's men are far less likely to take preventative action than women are.
Right.
Let
You're
me
saying
put
it very fastly, very politely. That, yes.
So that's why we need everybody, men and women, but primarily we need our women to help propel our men to also prioritize the way that they have.
Right.
Think about breast cancer survival rates. Breast cancer still afflicts a huge amount of women. But, and I don't say this lightly, right?
Right.
As a society, there's also never been a better time to get cancer because the options for treatment are much more available today. And the options for intervention, even when detected early, are much more available today. And we should be delighted with that, the huge progress that we've made.
Right.
But all of that falls short if it's not detected early. So a huge respect to the huge number of people who consistently spread appropriate information that allows people to take action for that to be prevented.
Right.
So I dream for a day where we can see that beyond breast cancer. We can see that in prostate cancer. We can see that in so many other broader diseases, whether it's pneumococcal diseases that genuinely affect a huge proportion of people. So it's possible. And we've seen that through incredible work that many people have been driving in Malaysia and beyond.
Right. Because it's interesting, sometimes people say it's difficult to make treatment available to everyone. But the opposite is also true, whether you are making yourself available to the treatment.
Correct.
That's there for you.
But just to build on that, right? It's also easier to make prevention available to everyone. If we made prevention available to everybody, we will not need to make treatment available to everybody.
Right. Right.
Because we would need to make treatment available to only those who need it.
And that's information. That's trying to make sure people are educated to be able
correct.
to.
Because the goal ultimately is, the dream is that not a single person gets the disease.
Right.
So therefore, I don't need to treat anybody. That's the ultimate dream.
Yeah.
Right? But to achieve that dream, I need to prevent it on everybody as much as possible. And now the problem is that if I don't prevent it enough with everybody, then my treatment capacity gets absorbed. So the more I can help prevent it, the more then I can make sure that my treatment capacity goes to those who really need it.
Right.
And that's how we make healthcare more affordable and accessible for everybody.
Right. And with things like vaccine hesitancy, the preventive part of things gets complicated when there's misinformation that's being spread, sometimes more rampantly than the truth can be spread.
That is real, and that is a real risk. And so as a science-based company, right, we do believe in democratizing science and ensuring that people have the facts available to them in a way that they can comprehend and make decisions themselves. And it's one of the big responsibilities that we feel we hold as a company. And obviously we're scientists and we're a science-based company. So for that, translation is best done by people who are professionals in communicating to broader audiences, right? But we can't take that for granted, because whether we like it or not, information is what people need. People are trying to make decisions and they are looking for information to make decisions. So the big responsibility we have is to make sure that we are appropriately contributing to the wealth of information available so that people can have the accurate information to allow them to make the appropriate decisions for them and their family.
Right. It's interesting that you say that, because sometimes it feels like even when we have this deluge of information that we're sharing with a mass audience, everyone knows the dangers of things like vaping and also cigarettes. But Malaysia is still seeing a worrying rise in vaping among teenagers and young adults. Some argue vaping is becoming the new cigarette. And for the next generation, which is dealing with this new pandemic or epidemic, how do we intervene now before this becomes a larger national health crisis? Considering it's already a large crisis as it is, there's so much hesitancy when it comes to giving up something that seems obviously bad for you.
Yeah.
Yeah.
So the MOH has taken a very strong and leading role in the discussions around vaping. Because the data that they have and research that they've shared widely accurately shows the correlation between that and significant challenges over time. The lung health initiatives that they've launched, etc., continue to look to reinforce that. And I know they've taken even stronger action around the availability of vaping products across Malaysia. So one, it's habits are hard to break,
Yeah.
but that does not mean that we shouldn't try and break them. Right? And I think charity begins at home. So as an employer,
Yeah.
we have hundreds of colleagues that come into our offices every day to come and do work, and we're proud of every single one of them. And so then the question I ask myself is, what responsibility do I have as an employer to start first and foremost in educating my own staff about the importance of looking after themselves and looking after themselves well, and the risks associated with activities including vaping.
Right.
And so I think we can do more of that. We can use some of our platforms that exist to all contribute into this effort. So if I can do that as an employer, you can do that, as a broadcaster. You can do that as a school teacher. You can do that as if you run a football club, you can do that educating footballers as to why that might be a challenge, right? If all of us pitched in to help to contribute positively towards putting forward positive public health messages, that is what will shift the dial.
It sounds like we just need to nag.
We just need to
Just
keep doing it.
nagging and nagging and nagging and reminding people this is bad for you.
But also in ways that allows people to appreciate the why. What we never want it to be is that people feel like we're trying to police the actions that they take. That's not right. For public health, ultimately what you're trying to do is to make sure that people understand and take responsibility for improving their health and taking positive actions that ends up improving their health. So I think the balance is important. What you don't want to be is to be seen to be nagging, and therefore people zone out and they don't want to hear it anymore.
They don't want to feel like they're being forced into doing something. They want to feel like it's their own decision.
Correct.
Making a better choice for themselves.
Correct. And rightly so. This is health. Right? Rightly so. And health is personal to all of us. And I think for those of us who are in the arena of improving the health and well-being of the population, we must also be patient with that, right? Consistent, diligent, but patient.
So much patience, team. It would also seem that non-communicable diseases like diabetes, heart disease, and hypertension continue to rise every year, even though, again, awareness is actually very high when it comes to this. It almost seems like it's falling on deaf ears. Do you think Malaysia has a lifestyle problem, a policy problem, or an access to prevention problem, or is it one big soup of problems?
So I don't think Malaysia has any of those. Because I do think that this is universal.
Right.
So let's take 2 steps back. As human beings, right? The life that we live today, our parents didn't necessarily live that, right? Whether it's in the nature of agriculture, whether it's in nature of industry, just life has evolved in so many different ways. So that sedentary lifestyle means that the way we process calories has also changed significantly in that time. So I think there is that universality about it that it's important for us to acknowledge. So I don't want to be finger pointing at any particular lifestyle challenges here in Malaysia, right?
So I can name one. Nasi lemak. That's one lifestyle challenge.
Nasi lemak is not necessarily.
You haven't had the good one. If you had a good one, you know how it threatens your life.
So I think the way to counter that in the long term is to make sure that as much as there's been greater opportunities around better quality of life, we just need to help reinforce that with greater opportunities around fitness and all of the preventative action that is needed to maintain a healthy balance. Because I think that's where we're getting the imbalances wrong. Because think about it, right? There is an argument that that is also a manifestation of the increasing affluence of society, right? And actually,
the problem is that we've got too much money to spend on things that are less than healthy.
Let's say we have more than we had, right? I wouldn't quite say it's too much, but I would say that and therefore as a result of that, we're able to make different kinds of choices, some of which may not necessarily be enhancing to the lifestyle, right? So I think we should recognize that and therefore not make people feel bad or that they're failing themselves just because they're progressing in life, right?
Right.
The question is, how do you get the balance right?
How do we get
How
that
do you
balance right?
By learning about the kind of things
Okay.
that allow that we can incorporate into our lifestyle every single day to help to moderate that. Okay? It's not a bad thing to enjoy quality nasi lemak,
Yeah.
but it's good to be able to figure out how to burn those calories after you've enjoyed them.
Right. There is no answer to that. I don't think that answer exists. But it will remain one of the mysteries of the universe for now. But like I understand what you're saying. Trying to tell people that it is so important to find that balance. But harping on it doesn't seem to work. How do we get them to make those decisions for themselves? It's always that difficult step to make people make.
One of the things I've enjoyed seeing, so my kids, for example, when we go out to shop to buy anything, one of the things they always do is to turn it around. And in some countries, they have this traffic light system that tells you whether it's red, green, or amber. And it's really interesting, the nudge effect that has. They'll turn it around and go, no, Daddy, we can't get that. It's red. Right? And I'm like, but it's delicious. They're like, no, it's red. So they think, no, we should get, because their teachers have told them that, amber, maybe. Red, be very thoughtful. But green, good. So their default is to push us towards doing that. And it's interesting. Over time, when you look at the basket has a lot more green and amber than it does red. So again, small things like that, right?
It helps you make decisions.
Right.
In Malaysia, the one that turns yellow, they'll just eat it. That amber sign is just a go. Okay, that's another. Yeah, you're right. Put systems in place
Exactly.
that can help people make better decisions.
Correct.
And they're making the decisions for themselves.
Correct.
All right. I think that's definitely going to be something helpful.
Think about the psychology of a traffic light, right? If you have an intersection without traffic lights, people will drive.
Right.
And they will slow down as you come there just to make sure sometimes maybe I don't bump into somebody, or somebody might go, actually, if I go straight and I speed, the other person will stop. Right. So, but then at that point, it's a game of chance.
Yeah.
So what do we introduce? We introduce traffic lights. Essentially what we're signaling is it's time for you to slow down so that the other person can turn. And typically when you do that, people follow.
Right. And everyone follows the same system because everyone knows what it means.
Correct.
I hope this happens. The traffic light system, great. We talked a little bit about vaccine hesitancy just now, right? It remains present, sometimes fueled by misinformation, like we mentioned. How do we rebuild trust in public health messaging when people are increasingly skeptical of institutions and more susceptible to take in information that is less than trustworthy?
So I think there are a couple of things that are important. Number one, clarity of information. So we owe it to everybody to make sure that the information available is clear, accessible, and honest. Right? That's where it starts from, right? So you can't say we're countering misinformation by not providing information. No, right? There has to be. But also, the fact that I provide information in a certain way doesn't necessarily mean it's accessible or understood. Right? So the first bit is information, but the second bit is ensuring that those who are most able to communicate have the ability to utilize that information to communicate.
So
and we need to be
understand
consistent.
Information, not just see the information.
Exactly. The fact that, I sent X many documents of so many information. Yeah, but then it doesn't mean anything to anyone, right? So if you cannot communicate in as clear a way as possible around the importance of certain actions to a 13-year-old, you have to ask yourself whether that information is clear and accessible enough, right? And to assume that, everybody speaks a certain language or speaks in a certain way, particularly in somewhere like Malaysia, that information needs to be available in ways in which everybody can connect to in their own respective languages so that it doesn't feel alien to them, right? And a huge credit to a number of charities that are doing this relentlessly in this space, whether it's, more specialist partners like NCNM, the Lung Cancer Network for Malaysia, and others who do very specific information for lung cancer patients, or whether it's more broad-based cancer type partners, whether it's NCSM or others across a range of other disease areas around diabetes, heart disease, etc. They are doing an incredible amount of work to be able to translate that. Right. I think the third part of it, in terms of misinformation, is also consistency. So one of the things I strongly encourage is that we make sure that we're very consistent in science-based conversations.
Okay.
So you hear, because we have an incredible regulatory system in Malaysia. Right? Credit where credit is due. The MPRA does an incredible job reviewing meticulously every product that is submitted to ensure that there is right scientific grounding, and then the label reflects exactly what they believe is appropriate and safe. Right? So the reason they provide that label is because they've looked at the evidence, and then they say, based on the evidence that we appreciate, this is how we believe this is used, right? That should be used optimally. That consistency is important because that is what reinforces trust. A label from MPRA should give me confidence that it says I can use it this way, but I shouldn't use it the other way. Obviously, the doctor will still utilize their own clinical judgment based on the person in front of them. But I don't know how much Malaysians understand that. I don't know how much Malaysians even know that. So I wonder whether we can do more work in that space for the incredible work that whether it's MPRA, CRM, and others do to be more understood across Malaysia. Because I think people will value that.
Because there's a way to verify the information.
Exactly.
But when you don't know
Exactly.
what that way is, you don't realize how to verify what you're
Correct.
reading.
Exactly.
So sometimes you need to actually spread information to tell people there is a way
Correct.
to verify what you're
Correct.
reading
Exactly.
and what the information that's getting to you.
Correct.
Maybe we need that. More money needs to be put into just publicizing ways of knowing how to verify the information that you're getting.
Potentially, yes. And even I think just the opportunity and the platforms for the regulators and others to share some of these things.
Right.
So, you approved X vaccine. Why? Right? What were the things you looked at? How did you feel about this challenge? Etc. And therefore, why does the label say this and why does the label not say that?
Right.
Why is the dosage this and why is the dosage that? I think it's because that will give people confidence that these things don't just land.
Yeah.
Right? These things are really rigorously gone through.
And why you should trust this information instead of the vitriol that is being spewed by this random guy sitting in his pickup truck in the middle of a desert that's telling you not to get a vaccine. It is so troubling sometimes when the more we discuss it, it feels like there's hope. And then you realize that the reality of it is work needs to be done.
Work needs to be done. There's no question.
There is, in healthcare, an underserved community. Patients living with rare diseases face some of the highest treatment costs, limited public funding, and long diagnostic journeys. What will it take to ensure these patients are not left behind just because their conditions are less common and less viable when it comes to the bottom line of companies that can build vaccines, that can build treatments, that can make treatments, but cost is a factor.
Yeah.
How do we work to make this
is a really important question. And I wish I had a very simple answer, but it's important that people also understand why this is a challenge, right? Think about the manufacturing infrastructure that it takes to make a car. And think about building a plant, right, that can make 1,000 cars a month. Right? In reality, what that means is that because you have the scale of being able to make £1,000 a month, if it costs you if it costs you ringgit 1 million per month to run that plant, it's the same plant. It still needs the same regulatory standards, it still needs the same environmental standards, etc. But because you're making 1,000 cars, potentially, therefore, it's 1,000. The cost is 1,000 ringgit per car. Now, if you're still going to make a rare disease that you only need to, or a rare car where you can only make 10 cars a month, you still need the same plant.
Yep.
You still need the same infrastructure. You still need everything else, all of the regulatory approval, the same thing. But now your 1 million ringgit is now on 10 cars, which means essentially it is 100,000 ringgit per car, right? And that's the challenge with the economics when you look at that. So I think that's the macro issue.
Yeah.
Fundamentally, though, our industry is based on science, and the reassuring part is that wherever there is unmet medical need, that is the fundamental driver in our industry. So we don't actually, for MSD, the economics come much later.
Okay.
The first part is we understanding what is the disease that has this unmet need and what are the scientific options that might be available to be able to address that, which is why we do a lot of clinical trials in Malaysia alongside clinical partners, because what we're also trying to do is to make sure that we're listening to the clinical needs in Malaysia. What are the clinical gaps And when you do that, you work alongside partners to discover new things. So that's the first part. So the fact that there isn't a big population that might need it, actually, that's a secondary problem.
Right.
Certainly for us as a company, or maybe as an industry as well.
Right.
So that's the good part. Now, the next part is once we have discovered the solution for it, then the next complexity then becomes how on earth do we figure out the commercialization model that allows us to be able to do it in a way that is sustainable.
Right.
And this is where it takes many hands to clap. We can't do it on our own. We have to be able to partner alongside governments, alongside funders, alongside insurance companies to ensure that the insurance plans and the government plans are in place to be able to accommodate some of that.
Right.
And because the populations are small, the budget impact is actually not that significant. Because back to my example of the 10, right? Ultimately, it's only 10 people. So the budget impact is not that significant. Now, where people would argue is that the budget per head is significant.
It's significant,
but
yeah.
you don't see the population need for that is not that much.
Right.
Right. So where we have to do for rare diseases is also help to educate the funders, whether it's public or private, about the fact that whatever the perceived cost of the said therapy, but the population that needs them is not that big. So therefore the budget impact is not as significant as they're afraid of.
Right.
Right? That's the second part.
Right.
The third part is, and again, people need to appreciate this, the way we fund healthcare today has not fundamentally changed in years and years and years. So let me give you an example. If you go back 100 years ago, if you wanted to, or 50 years ago, if you wanted to buy a house in Malaysia 50 years ago, I assume that a lot of people would save towards it, right? Yeah. And potentially go, with a basket full of cash, or at least something equivalent to that, to be able to go in and say, hey, I'd like to buy this property for this, right? Because bank accounts, etc., may not necessarily be as ubiquitous as they are today.
Right. Maybe home loans weren't as easily attainable.
Correct. Then we get into home loans being an option. And even at that stage, they'll tell you, oh, you have to have earnings of this, you have to have collateral of that, etc., for us to be able to get a home loan. I would argue that homes are not cheaper today than they were 50 years ago.
They're definitely not.
Exactly.
Yeah.
Yet, accessibility for homes is a lot better today than it was 50 years ago. So the question is, what has changed?
Finance.
Correct. So what has evolved is the mechanism through which people pay for homes.
Right.
Healthcare, we still pay for fundamentally in the same way.
Right.
Fundamentally in the same way, whether it's general taxation or whether it's a consumption-based insurance model. Fundamentally the same. So the question is, how do we evolve how we finance healthcare to accommodate rare diseases? We haven't got that far yet. And I think that's the challenge of our times.
But is this a conversation that's happening?
I think it is rightly the conversation that's happening across whether it's insurance companies, government. I know Bank Negara and others are having those conversations as we think about the sustainability of healthcare financing. But and the solutions would distinctly look Malaysian because what you need is a solution that works for Malaysia, which may be different to a solution that works in Singapore, for example, or elsewhere. But the good thing is the conversations are happening.
Right.
But I think more needs to be done just to make sure that, especially for rare diseases, that the voice of those who need those from the rare diseases is not lost in the bigger picture. Because the challenge is that people will assume that it's a huge amount of funding that is needed for everything. Yeah. Whereas for rare diseases, it's not a huge amount of funding. It's more or less...
Or it may not be.
Correct.
Right.
Because it's a smaller population.
Right.
In the grand scheme of things, it's not.
Right. It's interesting because whenever we talk about rare diseases, there is this clash of ethics and healthcare. Because it's not like we can't pull together the professionals to make it happen. It's how do we create some sort of infrastructure where everyone involved, all of the stakeholders, feel that they are benefiting from it.
Correct.
And that's a conversation that needs to happen amongst all of the stakeholders. We don't even know who all the stakeholders are at this point, but we need this conversation more. Absolutely. It's great that we can hear you say that as well. Now, if you could push for one major shift in Malaysia's healthcare mindset over the next 10 decades, over the next 1 decade, what would it be and why?
For me, there's no question. It's equitable access to preventative health.
All right.
There are diseases right now, beyond what the government is doing. Even if the government did nothing, everybody listening to this podcast and corporates working together, plus the industry working together and NGOs, there are diseases that we can eliminate in Malaysia by 2030.
Wow. And that's just by making a decision.
By making a decision, standing up, coming together, make a decision and going for it.
Right. Because it's preventable.
Completely preventable. Whether it's through awareness, vaccinations, prevention, whatever it is, right? There are diseases that we can eliminate by 2030.
Right.
And we should not wait for the government to do that.
Right.
We should say that we want to see a Malaysia that is free of this disease by 2030, and we can do it.
Right. I hear you. I'm going to go home and throw out every piece of sugar I have at home, and I will have no sugar.
There are diseases that we can do that. And
I am lying.
and also just on the equitable part for me is also
Right.
that's the bit that really keeps me up at night. I'm fairly convinced that if you're in an urban setting, that you have all the mechanisms available to you. But I don't know if it's the same if in rural settings. So I do think that for me that's the one thing I would say that we should focus on: equitable access, and specifically on certain diseases to see Malaysia being disease free within the next decade. And we can do it
Now.
We can do it right now.
Wow. Okay, we've come to the rapid fire questions part of today, Doctor. So whatever comes to mind first is the answer we'll accept today, okay? What's one everyday habit you personally swear by for staying healthy?
I walk.
Walk.
I walk.
Oh.
So I walk. I do my 10,000 steps a day.
Thank you for making us feel guilty, bad about ourselves. Okay, noted. Tell us one myth about health that you wish Malaysians would stop believing.
That prevention is not possible.
Right. We can make a difference
Absolutely.
in our own lives. Okay. One word your team would use to describe your leadership style.
Well, I hope authentic.
Authentic. Okay. A Malaysian food you always look forward to.
Now I feel bad answering this question. Nasi lemak.
Everything in moderation.
Yeah,
right?
correct.
After we've spoken about it, everything there is a place in our lives for nasi lemak. Okay, Doctor, a belief or principle that guides your toughest decisions.
Do the right thing and sleep well at night. I think just do the right thing, always. However hard it is, do the right thing.
Right.
And just sleep well at night.
Because it's simple to know what the right thing is.
Correct. But not always
to
easy to
actually
do.
follow through.
Correct.
Right. Okay. Your go-to I need to reset activity after a stressful day.
Oh, walking. So yeah, it's the same. After I leave
I should have known better than that.
long days of meeting, I just walk. And,
Right.
and I all the stress goes away.
Does it matter whether you're walking at home on a treadmill or whether you're...
I prefer to walk outdoors. Yeah.
I need to get
fresh
you
air.
somewhere.
Correct. And also some fresh air. Well, I understand not everywhere,
Got it.
not every airway has fresh air,
Yeah.
but
So where you can.
yes.
Okay. Okay, Doctor. Last question, which is something we ask everyone. If you had the opportunity to make one change as Prime Minister of Malaysia for a day, what would it be and why?
I'll go back to the equity question. I think the one change I'd make is so firstly, being the Malaysian Prime Minister for a day is an incredible responsibility and a huge amount of work, right? And all credit where credit is due. You know, it's a big responsibility. If I ever found myself in that position, the one thing I'd do is equity. I would make it a national celebration for those who continue to advance positive action that improves equitable access to health.
Right.
Because I think the impact of that is significant, and we should celebrate that. So people will go out of their way to build infrastructure that allows us to be able to reach hard-to-reach communities,
Right.
and in that process save lives. They're heroes.
So make it a
them national
celebration.
heroes.
Choose a day
100%.
and make it a public holiday.
Correct. Exactly.
You
Go.
just got everyone
Make a
on your
difference.
side.
Yeah.
Yes, because if what Malaysia needs most
It's another public holiday.
is one more public holiday, that's exactly what we want. Yes. You just won everyone over. Tell us when you're running, okay? We'll bring the nasi lemak. Thank you so much for joining us. We appreciate
Thank you for
so much.
having me. Really enjoyed that. Thank you.
With us today, of course, is Managing Director at MSD in Singapore, Malaysia, and Brunei, Dr. Abdullahi Sheriff. And we look forward to seeing you again
Thank you. I look forward to being back.
and seeing you in the next episode of Life Confessions.